Hi, I'm Nicole Formsma. I'm a master esthetician, and I've been in the transformative self-care industry for over 10 years now. And I'm talking today about Morpheus radiofrequency microneedling and why it's one of the most requested services that we do for our clients and patients at Rejuvenation Skin Lab. Morpheus8 radiofrequency microneedling is so popular because it addresses all the different ways that we get microimpressions of skin health and vitality. So when we're talking about remodeling collagen, when we're talking about contouring and sculpting the skin, turning over the cells so we have more even tone, smoother texture, all those different things, we're getting microimpressions when we're looking at people. Do they look healthy? Do they look rested? And healthy skin is beautiful skin. So whenever we're seeing that glow, that's the bouncing of light off of living cells. Whenever we're seeing bounce to the skin, that means that it has plenty of elasticity in it. Whenever we're seeing even tone, smooth texture, we know that there's plenty of circulation. So the way that the Morpheus works is we have the handpiece that has a tip on it with 24 pins that goes into the skin. And when each of these pins goes into the skin, we get a solid column that then collagen rushes to the site to remodel itself, and it kind of supercharges that process. Whenever these pulses are going into the skin, they're sending radio frequency energy, so we're able to shrink wrap the skin from the inside out. So the way that that transforms into results is we're seeing a lot more sculpting of cheekbones, we're carving out jaw lines, we're able to go after submental fat and adipose tissue and tighten the skin up around it. So with our client before and afters, what we notice is we're able to treat the neck, we're able to treat the jawline and the full face for global rejuvenation. We see a tightening of this area, skin appears smoother, it looks more lifted, and we're able to get this by turning on the body's own systems. We're not using injectables or anything that's foreign to the body. It's supporting its natural state of health and vitality. If you were to compare this treatment to an injectable treatment, when we're talking about addressing lines on the neck, you could have Botox injections there. When we're talking about double chins or shrinking this area under here, we're talking about Kybella. Injectables in this area could be filler to fill out the jawline. It could be Botox to sculpt the jawline, cheek fillers. There's tons of injectables that we could use to get the same results that we're getting with Morpheus. One of the most common things that people will mention to us when they're coming into our treatment room is the marionette lines around the mouth. They're noticing shadowing change and they think that they need more volume in that area. Most of the time what people need is not more volume in that area. It's just the lifting of tightening of the skin that they need to refine this area so that there's less shadowing. When you think about what filler is and what it does, filler's hyaluronic acid based. Hyaluronic acid loves water, it's a water magnet, and when we're injecting it into the skin, it can attract water over time. So if we're injecting it in the nasolabial lines, that can cause more of a bloated appearance. You can have more of like a pillow face that you'll hear people talk about because we're bringing all that forward. And it can change if you've had a night where you've had some wine or you've eaten a lot of salt. This is not the area that you really want to feel puffy. We love it for our lip area, and that's totally fine for us to experience that luscious pout. But for the face, it's different. It's a lot more sculpting based. We have patients that will use this treatment for scarring. It's great anywhere on the face or body, so we can use it for loose or crepey skin, stretch marks, scarring on other areas of the body post-surgery, or other elements, and it really offers a comprehensive global rejuvenation in one treatment. If you've done any research on Morpheus8 radiofrequency microneedling, you can see that people have had a whole range of experiences with this particular treatment. Some saying it's very comfortable and others talking about how painful it is. It's so practitioner and office specific as to what pain management options are available. We're able to treat a lot more effectively with the settings that are most ideal when our patients are the most comfortable. Some of the things that we've incorporated into our treatment to make sure it's an easy process is compounded numbing. So when our clients come in for their treatment, they're going to be numbing with a topical compounded solution for about an hour ahead of their Morpheus treatment. We found a numbing solution that's able to numb on the surface of the skin where those 24 pins are going in, as well as inside the skin where we're sending that radio frequency energy. During treatment, each of our clients is given a Pronox tubing along with the Pronox equipment so that they're able to take in laughing gas as they need to during treatment or as they want to make it a more enjoyable, easy experience. For those patients that still need a little something extra, we have other options as far as prescriptions or even injectable lidocaine that we're able to do. Most of the time that's not required. With our numbing and with a Pronox solution, patients typically report this treatment to be about a 3 to 5 out of 10. And when they're feeling the spicier pieces, it tends to be one-off places. The upper lip, because of all the nerve endings, there tends to be a little sensitive. And around the eye area, because it's thinner skin, can also be sensitive. Depending on the way that we're treating our patient in front of us, will determine where we start. So that way we're able to start with some of the zingier parts when they're fresh off of the numbing cream, so it's a lot more comfortable. We have 2 microneedling options at our office, so you might be wondering which one is the right fit for you. If you're looking to address surface textural issues, coloring issues, introductory to aging with fine lines and wrinkles, addressing redness or reddiness in the skin or capillaries, things that are with the skin itself, the InnoPen is going to be the right fit for you. It's where we're using a pen to stamp the skin while we're feeding it exosome therapy and healthy ingredients. With the exosomes, it's like PRP on steroids. We have over 450 growth factors. We have a lot of stem cells, a lot of anti-inflammatory properties. So we're able to push that into the skin and deliver it about 40% deeper than we're able to do with just a topical application alone. People notice that their skin looks a lot more uniform and even, and it's not that they're looking to get as much contouring done or deeper remodeling work done. A good way to think about it is if you are putting on a new outfit versus going to the gym. When we're putting on a new outfit, we're changing what's on the surface of our body to express differently versus going to the gym where we're reworking our body and changing the physical components of our structure. So with the radiofrequency microneedling in the form of Morpheus8, that's our gym time where we're doing the heavy lifting. We're doing a lot more carving out, we're doing a lot more sculpting and contouring of the face, and we can address deeper rooted issues like festoons or fat pockets underneath the eyes. We can address more of double chin, jowling that's sagged over time. We're really working against gravity here with this particular treatment because of the shrink wrapping of the skin that happens when we're sending that radio frequency energy in. We are also able to go into the skin a lot deeper with the Morpheus treatment. When we're doing traditional microneedling, the deepest we're going is 2 millimeters into the skin, and that's not usually typical with most areas of the face. We're working more superficially than that. With the Morpheus8, we're able to go in 4 millimeters into the skin, so we get a lot more deeper remodeling, and we're actually sending the radio frequency energy in 5 millimeters. So we're getting change all throughout the structure of the skin. So if you're looking for deeper rooted issues, you want to kind of change your appearance in photos so that you're not having to tuck and tighten and lift as much, the Morpheus8 is going to be the best option for you. The best way, if you're still unsure to figure out your treatment plan, is to come in for a consultation where we're happy to show you our own client before and afters and go through what your goals are and line you up with the treatment that will best achieve them.